Hi, I'm Dr. Aaron Bates, your Ventura County Spine Authority, and today we're going to go over a case study and treatment of a patient who suffers with vertigo. And we're going to go through our secret weapon on how we get great results with this debilitating condition. Now, there are many different types of vertigo. Anything stemming from a swimmer's ear infection that can cause dizziness or spinning, all the way up to a brain tumor would be the most advanced form of deep-rooted cause for vertigo. But we're going to go through the most common type of vertigo, which is called Benign Paroxysmal Positional Vertigo, which basically in the medical world means we don't know where it came from and we don't know how to treat it. Because there is no specific treatment protocol, oftentimes this debilitating disorder is downplayed to a mild condition. But try telling that to somebody whose world is spinning. It can be very frustrating and very scary.
When I suffer from vertigo, the way it makes me feel is so powerless. You can't focus on anything. It really takes out of your life. You can't balance. You're not able to walk properly. Look at people. You have to, even if you try to stay in bed, like with a migraine, it sometimes helps to lay down. Laying down, standing up, sitting down, you're spinning. You're going counterclockwise and then the world's going the other way. It's the most awful feeling. It's not good to have. It just stops your life, literally.
There's three neurological components we want to address in the assessment. One is gait, or how a patient walks. Two is their balance. And three is their cranial nerve assessment. The cranial nerves are the 12 nerves that rest in the upper cervical spine that control the function of the head and part of the shoulders and most of the movements of the face. One of the reasons why vertigo is such a mystery to the general medical world is a generic neurologist will do testing that oftentimes is not sensitive enough to find the neurological positive findings with vertigo. In Jeannie's case, we find a lot of her positive neurological findings in her cranial nerves. So we're going to do some of the testing that the general neurologist would do, and then we're going to show some of the more advanced testing where we'll actually find the positive tests. One of the classic neurological tests your generic neurologist will do is a field of gaze test, which is actually done in an H pattern, and it looks something like this. So I'm going to have Jeannie follow my fingers. As I do this test in an H pattern, I'm looking for any movement in the head, change of patterns in the eye movement, or nystagmus. And as you can see, her eyes do bounce around from position to position instead of a smooth movement. Another positive for this would be an increase in vertigo symptoms. Another test we would do is the head positioning. Now, with a lot of vertigo type of symptom presentations, these tests will not show up. So we use neurological stacking, where we do two different tests at the same time. In our field of gaze, the more advanced testing, we do it in a star pattern, which actually tests each individual cranial nerve that actually is responsible for movement. And it looks like a star. And you're going to see several areas where Jeannie actually has a shifting in her eyes, which is known as nystagmus and is a positive for neurological dysfunction. Go ahead. Another positive for neuro stacking is when we do a field of gaze test and look for any other myotome weakness in the body. When we find a position of dysfunction, the arm strength will actually tether and get weaker because the patient can't do those two functions at the same time. Now we're going to do an anterior dorsal to open up the mid-back, which will help give us a better neck adjustment, as well as help the patient to oxygenate better, which is really important for any neuro dysfunction. Now we're going to check for segmental dysfunction of the upper cervical spine. 100% of patients in the last 10 years coming in with vertigo will always have upper cervical spinal segmental dysfunction. And so the best and most effective and safest way to restore that function is through traditional chiropractic adjustment. There you go. Next, we're going to do myofascial release on the suboccipital muscles, restoring natural symmetry and tone of the upper cervical musculoskeletal spine. We utilize the light-emitting diode to actually neurologically activate the upper cervical cranial nerves. There are different pulse patterns for each different treatment. We place that right on the upper cervical spine. The fourth part of treatment that we use is neuro stacking in the form of neuromuscular reeducation. What that means is the areas that we found weak, we're actually going to stimulate while we're using the low light level therapy. And the way that we do that is I'm going to have Jeannie open her eyes, and we're going to test the exact same patterns that she had weakness for. And as we do this, we're actually going to see that her eyes are moving smoother, and the more we do this, smoother. It's just like exercising a muscle that's weak, only in this case it's a cranial nerve attachment to the muscle. Very cool stuff. So we're going to look for any nystagmus, any movement of the head, any lack of smoothness or break in the smoothness of the eye movement. Everything looks pretty darn good. If we see any dysfunction, we're just going to repeat what we did or maybe find any other areas of weakness.
When I underwent chiropractic treatment, my experience was so positive. Everything is just better. I feel better. I feel healthier. I can breathe. My asthma, I don't have to use my inhaler. I used to use it every single day. It's such a good feeling to be able to walk out, smile, see things brightly. It's given my life back.